Friends of Cancer Patient is a U.A.E.-based charitable organization. Friends of Cancer Patient, or as we lovingly like to call it, FOCP, has been established 21 years ago under the directive of Her Highness Sheikh Jawahir bin Mohammed Al Qasimi, wife of the ruler of Sharjah. Her Highness had a vision of an organization that serves U.A.E. community that works on 3 pillars. We have used those 3 pillars and objectives to create what FOCP is all about today. Our first pillar focuses on patient access, and we don't speak only about providing financial access for the patient, but also moral and psychological support. The second pillar is all about the community. We want a healthy community in the United Arab Emirates that is well educated about cancer, their risk factor, and most importantly, prevention and screening measures. We focus in our second pillar on early detectables, cancer, and also how to provide screening program for it. Our flagship campaign is Pink Caravan that focuses on both cervical and breast cancer, and we have actually acquired a state-of-the-art clinic that offers free access for screening to all U.A.E. community. Our third pillar is advocacy. Although Friends of Cancer Patient is well known for patient access and community awareness, our first and second pillar across the United Arab Emirates, but advocacy took FOCP work globally. Through our numerous membership, regionally and globally, we have acquired lots of partners and we acquired lots of support from various partners, and we have been advocating cancer and cancer policy not just on a national level but on a global level as well. We enjoy knowledge sharing with different partners like the Gulf Federation for Cancer Control, UICC, Union International for Cancer Control, American Cancer Society, and UK Cancer Research, among a lot of other partners that we have globally. Of course, one of our new addition to Friends of Cancer Patient is what we lovingly called Amira Fund. It is in the memory of our late president who passed away very young, tragically, 4 years ago. The fund has enabled FOCP to expand our work beyond the U.A.E. borders to go globally. We provide also patient access and capacity building for lower and middle income countries. Our motto in FOCP is "We are with you," and we are Friends of Cancer Patients.
Friends of Cancer Patient and its initiative Shanab, in collaboration with University of Sharjah, are honored to invite you to this awareness session, Testicular and Prostate Cancer, presented by Professor Michael E. Otim. Now I will leave Professor Michael to start his session.
Thank you very much, ladies and gentlemen, for sparing your time to come and listen to me talk about the male cancer awareness issue. This is hosted by the Friends of the Cancer Patients, and this initiative is called Shanab. Now, Shanab is a male cancer initiative, male cancer awareness initiative on testicular and prostate cancer. And my name is Michael Otim. My friends call me Mikhail, so you choose what to call me. From University of Sharjah. The Friends of the Cancer Patients was founded way back in 1999 in Sharjah, U.A.E., under the directives and the patronage of Her Highness Sheikha Jawahir bint Mohammed Al Qasimi. It's committed to help cancer patients and their families financially and morally on a mission to create a more cancer-aware society through our Christi program. Cancer is no longer a problem. the rising rate is no longer a personal problem. The rising rate of cancer incidence makes it a public issue that requires shared responsibility among all. Here is a map of U.A.E. It's a very nice shape. I'm from Australia. It looks like an instrument the Australian traditional people use for protection. COSH, called early cancer detection, was launched in 2010. COSH, which means detection in Arabic, is an initiative by the Friends of Cancer program for early detection of cancer, creating an awareness and helping promote screening and prevention for the early detection. Why am I repeating myself on the question of awareness and detection? It's because with cancer, there is no solution. There's no shortcut. There's no medicine yet. Maybe one day we shall. The best solution is early detection, early investigation. If you can find something which looks like it and feels like cancer, then it must be cancer. And the moment you see that, you feel that, you have to run at the highest speed to the hospital. Let them then do more investigations, either to confirm or to disprove the fact that you may have cancer developing. Once that is done, a lot of things, the survival rate is extremely, extremely high. We have about 4 programs at the moment. We have breast cancer, which started in 2011, and it's dubbed Pink Caravan. And most people who are at risk are the ladies who are 20 years and above. Now, once the Pink Caravan picked up and started running, and most people got to understand what it was, the Friends of Cancer patients were able to start 3 more programs that are now running. And these are the childhood cancer, skin cancer, and men's cancer. Now, childhood cancer started in 2014. In fact, all the 3 started around 2014. And the childhood cancer is looking at those between 0 and 18 years of age. The skin cancer is anybody above 6 years of age. Now, the male cancer is from around 15 years and above, the Sharjah. And this is what we are going to talk about today, is our topic of interest today. Let's go back to the basics. What is cancer? Cancer is a group of diseases that are characterized by uncontrolled growth and spread of abnormal cells in the body. If the spread is not controlled, not detected early enough, it can result into loss of life. It can result into death. This is a quotation from the American Cancer Society. Sharjah, as mentioned before, is a program for men's health, started in 2014 and focuses on those who are 15 years of age and above. This initiative targets men and is in two groups. There is prostate cancer and there is testicular cancer. Prostate cancer focuses on those 18 years and above. And then the testicular cancer targets those who are 15 years, between 15 and 35. Now, Sharjah means a mustache, as I had mentioned earlier on. It's in Arabic. It's one of the Friends of Cancer latest initiatives that focuses on prostate and testicular cancer. Launched in 2014, Sharjah targets male population in the community and works with different healthcare stakeholders, e.g. the Emirates Urology Society, to create and promote awareness about male cancers and their early detectable methods. Now, let's start with testicular cancer. Testicular cancer usually strikes men between the ages of 15 and 35. It occurs in the testicles. Some people call them testes, which are located inside the scrotum, a loose bag of skin underneath the penis. The testicles produce male sex hormones and sperms for reproduction. More than 90% of the cancers of the testicle start in cells known as germ cells. These are the cells that make sperms. Testicular cancer is highly treatable, even when cancer has spread beyond the testicles. That is a good thing with the testicular cancer. Now, the good news is that a man's life chance of developing testicular cancer is about 1 in 270. So we say that if you go and stood on the main road and counted the men that are crossing you, 1, 2, 3, 4, 5, by the time you reach 270, there's a chance that one of those will develop cancer. It's a low chance, and but it's no joke. It doesn't matter. Nobody should have cancer. Whether it is 1 in 1,000, whether it is a child, whether it is an old man, nobody should. Because to look after a person with cancer is one of the most horrible things one can ever do. I'm not a clinician. I don't treat people with cancer. I am a public health expert. My focus is to look at society, to look at a large group of people, and think of the solution to prevent or to reduce the chances. And if we can't prevent or reduce the chances, to be able to detect how early we develop the cancer. Because once we detect early enough, then we have a chance, a strong chance of survival. Statistically, testicular cancer is the most common cancer of the genital system in men. It's the most common cancer in men. Around 50,000 new cases and 10,000 deaths from testicular cancer are annually diagnosed around the world. This is according to Testicular Cancer in the World and Epidemiological Review. In other words, it's a solid study with a solid piece of evidence that we cannot take for granted. Early detection of testicular cancer makes a positive difference in the treatment and the outcome of the disease. In males, colorectal cancer is the most common cancer, representing about 15 to 15.5% of all malignant cases in the year 2014. 5 most commonly diagnosed cancers among men are colorectal cancer, followed by prostate, about 10%, leukemia, about 8%, bronchus and lung cancer, about 6.5%, and the urinary bladder of equal proportions to the bronchus and the lung. Many experts keep scratching their heads trying to find out what is the cause. Nobody knows the cause. We just know what happens, that the cells run crazy and begin spreading and causing havoc, leading to a specific type of cancer. Now, we know that the best solution is to have healthy lifestyle, have physical exercise, avoid overweight, have early detection, and then have treatment. If you do that, if you do any of those, your survival rate increases dramatically. So, who of us is at a high risk of developing male cancer? According to the Canadian Cancer Society, there is no single cause of cancer. A male may be at risk if he is between the ages of 15 and 35. Just the fact that you're 15 and 35, between 15 and 35, puts you in danger. A male person may be at risk if he has a delayed drop of the testicles into the scrotum at birth. You have your baby. The testicles should all drop in the scrotum. But if it stays longer without dropping out, that puts that kid in danger. So if it doesn't grow, talk to your doctor, talk to your clinician, and see what can be done. If there is a history in the family of testicular cancer, either the father, the grandfather, the uncles have had testicular cancer, puts that child at a high risk of developing cancer. So in other words, you should keep an eye and be vigilant to look after that kid to make sure it doesn't develop a dangerous type, it doesn't get to a dangerous stage of cancer. If you have had abnormal testicle development, which we could say just like the delayed drop of the testicles into the scrotum, you are at risk of getting cancer. If you've had a certain rare genetic condition, you are at risk, my friend. One testicle is significantly smaller than the other. If one testicle is many times smaller than the other testicle, you know you have to keep an eye on your child. And that child has to keep an eye on himself when he grows up to make sure that if he develops cancer, he quickly attends to it than letting it become a problem. Now, what is weird and funny about this testicular cancer is that some men get a disease with none of those risk factors. Now, some public health experts argue that being exposed to smoke, to cigarettes, to shisha, puts that child in danger of testicular cancer. That has not yet been confirmed. That has not yet, not a lot of studies have yet been done, because when the issue of a cigarette appears, lung cancer immediately comes in and overshadows any other type of cancer that cigarettes cause. But what we know is that cigarettes cause a significant number of different types of cancers. Lack of physical exercise also is found to be a cause, to be related to different types of cancers. But that doesn't mean everybody is going to get cancer. Okay? It only means that we should keep an eye and be vigilant about our health, even if we don't have those risk factors. Even if we don't have a chance of getting the cancer, we should look after our health and be vigilant in all ways. Now, we want to talk about the symptoms. What is that? How do I tell that I have something close to a testicular cancer? Often the first symptom of testicular cancer is a hard, painless lump on either testicle, other than. Other symptoms can include, but before I talk about those symptoms, let me repeat myself. The first symptom of testicular cancer is a little stone. You feel a little stone, but it's not painful at all on either side of the testicle. It can be your left, can be on the right. As long as you feel anything hard, then you know you should seek further medical advice. Often, the first symptom, other symptoms can include, I use the expression can, include a change in the size, shape, tenderness, or the feel of the testicle or scrotum. So if suddenly your testicles grow big or take a different shape, or they become very sensitive to almost an extent that you can't wear underwear or something, then you know there is trouble around the corner. The swelling or pain in the testicle or scrotum is another sign that there is trouble around the corner. Do not waste time. Go to a clinician. A feeling of heaviness or dragging in the lower abdomen or scrotum should indicate to you that there is something wrong with your body. At that time, possibly the testicles have not developed these other signs we are talking about, and you think everything is all right. Feeling heavy, as if you're dragging your lower abdomen or the scrotum, should warn you that things are not very good. A dull ache, you feel a pain which is not very sharp, not in the lower abdomen or the groin, is a sign that there is some trouble coming. Unusual backache that does not go away. Unexplained weight loss. In a world today where everybody is putting on weight and you cannot explain why you're losing weight, should make you think twice. Feeling sore, feeling pain, and sudden unexplained growth of your breast, the man's breast, you should know. You should be suspicious. There is trouble coming. Mushikla Kabira. Some males get testicular cancer without any of those symptoms we are talking about. If you have any of the above symptoms, do not hesitate to contact your physician or other medical professionals and have your concerns checked out immediately. Okay? If you don't feel any of those pains and something suddenly doesn't feel right with you, please talk to your doctor. Now, if you have discovered, if you have sensed, if the doctors have checked and examined and tested and found that yes, you have testicular cancer, what are the possible ways of intervening? Remember, there's no treatment. There is no medication, no tablet you can go buy from the shops, or drink you can buy from the pharmacy, and you drink and everything will be all right. You have to go the hard way. The different ways of handling testicular cancer include, and I repeat, include early detection. If you missed to detect when it was early, then you'll have to have surgery. You'll have to have an operation. After the operation, it will be accompanied by radiotherapy or radiation. And once you have radiation, you've got to have chemotherapy too, because it could have spread into different parts of the body. And the worst case scenario, when if they discover that you had cancer when really late, and when things were really bad, is the high dose of chemotherapy, stem cell transplant may help with testicular cancer. But of all these, the best treatment is the early detection. I hope I'm not scaring anybody. I hope we are all we are together. We understand. We are facing one of the many problems and challenges that we face as human beings. I've emphasized early detection. And early detection involves self-examination. Self-examination means you have to examine yourself. Now, how do you do that? First, you will feel a soft, tender, something like a cord, which is a rope at the back of each testicle. If you feel those things, tender, soft, ropey, at the back of each testicle, that is normal. That is how those organs are. Okay? Now, once you keep doing that, you will get to know how your testicles are. And you become familiar with it. After you become familiar with it, how it feels, you will be able to detect any small change, if either getting tender or getting getting a little stone, anything that comes into it, you will be able to detect. And then you can handle it. You can deal with it. And to do that, you need to check at least once a month. Some people argue that you're better off checking once a week when you're starting. Once you know how it feels, what it feels like, then you can reduce to once a month. In other words, the parents have to teach the children how to examine themselves. Many men are not aware that testicular cancer is the most common cancer among males between the age of 15 and 35. They all think when you're 15, between 15 and 35, life is fantastic. Nothing can ever touch you. Nothing can ever disturb you. You are always in the best of health. True. But you just never know that testicular cancer could have invaded you. When detected and treated early, testicular cancer is one of the most curable forms of cancer. So it pays off tremendously to detect it early because you will get better. So let's talk business. What is testicular self-examination? If I was in front of you, I would have asked you guys to tell me what it is, how to do self-examination. Take a shower. This will warm you, and once you become warm, the scrotum will become warm and relax, and the testicles will drop outside. Stand in front of the mirror. Check for any swelling on the scrotum. There should not be any pain when you're checking your testicles. Hold each testicle so that you can feel the size and the weight of each one. It can be common for one testicle to be slightly larger than the other, and one may also hang a little lower than the other. You should not worry about that. Just continue examining. Roll each testicle between your thumb and forefinger. It should feel smooth. I repeat, cup your testicles at a time using both hands. Best performed during or after a warm bath or shower. Examine by rolling the testicles between the thumb and the fingers. Use a little bit of pressure just to feel it. Feel for lumps. Look for little stones, little beads or irregularities, change in size. It is normal for one testicle to be slightly larger than the other. Okay? That is what I wanted us to talk about as far as testicular cancer is concerned. Now, the second type of cancer that men should be conscious of is what we call prostate cancer. About 1 in 7 men will be diagnosed with prostate cancer during a lifetime. See how common it is? Imagine you are seven people. Throughout your lifetime, one of you is likely to be diagnosed with prostate cancer. Prostate cancer begins when cells in the prostate gland start to grow out of control. The prostate is a gland found only in males. The size of the prostate can change as a man ages. Early detection before the cancer escapes the gland is extremely important. That early detection, followed by effective treatment, when the cancer is still localized on the gland, can very likely save your life. Okay? We said, what did we say about prostate cancer? 1 in 270 are likely to develop testicular cancer. And to make it worse, it's the young ones, the 15 to the 35s. Prostate cancer is much, much common. 1 in 7 will likely be diagnosed with prostate cancer during their lifetime. Now, here are some facts that every man who is over 40 years should know. Now, you can see that from 15 to 35, you are in danger of testicular cancer. It feels like you got 5 years of a holiday to turn to 40, and then you begin worrying about prostate cancer. But here are some stories. What is the first? What is the prostate gland? It is that part of the male reproductive system. Its major function is to secrete a fluid to nourish the semen. That fluid is like water for a fish to swim through. The prostate is about the size of a walnut, but it can grow with age. Now, I'm not sure how many of us know what the size of the walnut and why they chose a walnut as an example to compare with the prostate. But because of the shape, it looks like a walnut. Here is a picture. You can see the prostate is between the rectum and the bladder. And it's through the prostate that the urine comes through and other fluids come through. It is located right below the urinary bladder, in front of the rectum surrounding the urethra. That is a canal for the discharge of urine that extends from the urinary bladder to the outside. So the question is, what are the symptoms of prostate cancer? You might not have any at all. Often there are none. Often they are not recognized. They are there, but they are not recognized. The major symptoms, the big ones, is that you'll be running to the toilet very often, so often. Okay? If you run to the toilet frequently, the bells in your head should start ringing that it is possible. It is possible this fellow is coming for me. The other problem is, even when you keep running to the toilet, the urine doesn't come out, doesn't seem to come out, doesn't seem to want to come out. It's as if your tubes are getting blocked. The urine comes very slow and often very painful. Okay? At different stages of the cancer, the urine comes with blood, okay, or with semen. And that's why personally, I discourage most people who use that bluish soap that you put in a tank of water, so that after using the toilet, you flush, thinking that soap will clean the toilet and keep it clean and keep it sweet smelling. If you do that, you will not be able to see the blood in the urine. Okay? You don't want that. You want to see the urine. You want to see the blood. Then you can run to the doctor. The other sign that you are in trouble with the prostate cancer is impotence. Impotence means the batteries have gone flat. Your member cannot get up. If it gets up, it only remains standing for a very short while. The other thing is you'll have lower back pain, which is very complicated, because lower back pain is a very common thing for a lot of other reasons. But the other interesting thing is that the prostate cancer tends to give you pain on the thigh. All these, as long as you have pain, as long as you have unexplained pain, as long as you have unexplained frequency of running the toilet, or blood in the urine, or whatever, run to your doctor and have it checked. And of course, if the batteries are gone down, you go and see your doctor. Don't go and demand for Viagra. Demand to know why. Demand to know why you have impotence. Because it could be the beginning of the deadly prostate cancer. So why do some people tend to have that cancer? Age itself. The risk increases once you grow older, but about a quarter of the cases diagnosed are normally aged under 65 years old. The race, the color of the skin. In the US, it's reported that the African Americans have a high rate of incidence, a high incidence, double that of Caucasian men of getting prostate cancer. Now, the family history of the cancer as well determines whether men we are likely to have cancer by about 2 to 3 times. The food we eat, a high diet in saturated animal fat can double the risk of developing prostate cancer. So we have every reason to look after what we eat. Unfortunately, we can't change our race. We can't change our family history. We can't change our age. We are growing younger every day, and the risk increases. Effective interventions for prostate cancer are 2. The first one is early detection. The second one is early detection. Since symptoms can be caused by other conditions, annual testing is extremely important. Okay? Once you turn 50 years of age, once you turn 40 years of age, go to the doctor once a year and have the total body check. It's like having a beautiful car. When it is brand new under warranty, you don't need to go for major service and all those sorts of things. But once your car gets old, you got to go and have a thorough check of what could be a potential problem. If you're going for a long drive, you've got to go for a thorough check. If you know, a lot of reasons to have it checked. So the same thing with prostate cancer. When you're checked by the doctors, they will check for what they call PSA, prostate specific antigen, which is a blood test. It sounds like the corona PSA, the corona check that we go and they stick that thing inside the nose. Digital rectum examination, DRE, is what the doctor will go for. Once the PSA shows that there is something abnormal, there are so many antigens in the blood, the doctor will get a camera and send it inside there and check to see how your prostate is. The two together are often able to detect prostate cancer better and sooner than the test alone. Okay? When do I need to get tested? The digital rectum, it should be around 40 years and older, every year according to American Society guidelines. The PSA every 50 years, according to the older and older every year, according to American Society guidelines. If you have a family, if you have cancer, male cancer in the family, your dad, your grandfather, your uncle, and so on, or, you know, you should check yourself. If you're an African American, if you're Obama's cousin, you got to get ready. You always have to check. 45 years and older, every year. These are all guidelines that have been studied and studied repeatedly and tested repeatedly and have been found that they are able to detect the cancer. So do not undermine those guidelines and say, well, it is those, you know, who are probably having this guideline, who need these guidelines. I don't need these guidelines. I am okay. Go and see your doctor. Have your checks, and then stay happy. How do you reduce the chances? Besides quitting smoking, some of the most important things you can do to help reduce your cancer risk are weight. Get to a healthy weight and be there throughout your life. Make physical activity one of your pastimes. Exercise on a regular basis. Have a nice meal. Avoid that junk food. I normally ask my students, what is junk food? Many of them have no idea what junk food is. Junk food is that food which has exceptionally high salt, exceptionally high levels of sugar, exceptionally high amount of fat. Those are the foods that are dangerous. One other very, very important thing, one other extremely important thing in those signs of junk food is the amount of fiber. If we had time, we would talk about colon cancer. Having no fiber in your food so commonly that what you eat is McDonald's, KFC, and all those foods where there is no fiber, puts you in total danger against colorectal cancer. But our interest today is testicular cancer and sorry, excuse me. Our problem today that we're interested in is testicular cancer and prostate cancer. Okay. We mentioned 4 things. We mentioned weight, physical activity, and the diet. The diet, a balanced diet rich in fruits and vegetables. 5 servings a day will give you enough fiber. lower your intake of red meat, processed and fried foods. Eat more plant-based foods like soy proteins and so on. Watch the portions. And that is something that we often forget. We eat food as if we will never see food again. Watch the portions. If you're very pedantic, you can go and make sure you always measure that you need 90 grams of meat in a meal. Eat food with lycopene. These are the tomatoes, the watermelons, the red grapefruit, which may be associated with a decreased risk of prostate cancer. Avoid high salt, avoid high sugar, avoid transgenic fats. You need high fiber. What is transgenic fats? These are fats that are made in the factory. Okay, we know that it's what they call saturated fat. That is animal fat. But there's also fat that is made in the factory. When you make it in the factory, it can stay outside. You don't need a freezer. You don't need a fridge to store it. Okay? Cookies, biscuits, some of these fried foods all have transgenic fats. Yes, some people may label the packets 0 transgenic fats. My friend, how can you trust such food which is hanging on the shelf for 6 months without trouble? A friend once told me, if you go and buy fruits and veggies which have insects, because that's healthy food. But the one which is very clean, very soft, it's as if it's been polished, has wax, and is not healthy. Because the one with insects means it doesn't have those dangerous things that kill insects. If that thing can kill an insect, then it should kill you too. In summary, interventions for male cancer include early detection, and early detection. Once you turn 50 years and above, please make sure you have an annual health check. When once you've missed the cancer, you've missed in the early detection, or you've missed during the health check, and then you discover later, surgery is a solution, and radiation, together with the chemotherapy. The worst case scenario is the high dose of chemo and stem cell transplant. Maybe with the time, a stem cell transplant, once our knowledge has increased, will be used for treating cancer in everybody. Thank you, and thank you very much for listening to me. I hope this has touched you, and you will be able to look after yourself and look after your children. If you need more information on today's presentation, my personal number is on the board. 55 99 32 323 055 99 32323. Thank you, and thank you very much.
Thank you, Professor Michael E. Otim from University of Sharjah for the informative session. Dear audiences, kindly follow Friends of Cancer Patients on the social media for more awareness session. Thank you.